Hello, welcome to Health Talk with Dr. Toyin. Today we'll be discussing low back pain. Low back pain occurs where there is pain running from between the rib cage at the back to the creases on top of the buttocks. Sometimes this pain can also run down the legs, but that will be a discussion for another day. It is very common and can affect up to 20% of the population at any time. It is commoner in the ages between 45 and 59 years. When it is due to manual work, it's commoner in males. To give a better understanding of what can cause this pain, we'll look at a diagram of the spine. The spinal cord consists of 33 bones, and each bone is called a vertebra. The spinal cord is divided into 5 main groups. The first group is the cervical group, which consists of 7 vertebrae. The second group of vertebrae is the thoracic vertebrae, which consists of 12 bones. The next group is the lumbar vertebrae, which consists of 5 bones. The sacral section consists of 5 bones fused together, and lastly there's the coccyx or the tailbone. Lower back pain consists of the lumbar vertebrae, sacral vertebrae, and coccyx. In addition to the vertebrae, there's also the spinal cord, spinal nerves, ligaments, muscles, and intervertebral discs. There are some things that can predispose one to get low back pain, which includes repetitive work, manual work, sitting or standing for prolonged periods of time, pregnancy, and also increase in weight or obesity because of the pressure on the spine. As stated in the title, pain is common and that is why it is low back pain. You might be uncomfortable at night because of the pain, but if at any time the pain wakes you up from sleep, you do need to seek medical advice as soon as possible. If you do have low back pain and you notice you have problems either urinating or opening your bowels, you do need to seek medical advice as soon as possible. The spine is a common place for cancers to spread. So if there is a suspicion of cancer or a past history, back pain should be treated as being serious at that time. Back pains normally resolve within 6 weeks. It is known that at least 90% of cases will resolve within that time. But if it doesn't resolve, you can seek medical advice. To help with back pain, painkillers like paracetamol or non-steroidal anti-inflammatories like ibuprofen can be used, but these should be used regularly and not when required for the pain. Bed rest for prolonged periods is not advisable because it can actually increase the pain. It's good to get a balance between working too much and not working enough, and probably just maintaining what you normally do. But if this does involve manual lifting, you might want to consider taking a break but not submitting yourself to bed rest. For some people, manipulations like acupuncture or visiting the chiropractor might help with low back pain. There are some documents on how to properly handle objects which can be found on the Health and Safety Executive website. So please visit this site to see the proper way of handling heavy objects. There are some exercises that can be found on the Arthritis Research UK website which can help with low back pain. The use of ice pack or hot water bottles is also beneficial to low back pain. You might also need the use of physiotherapy to help with back pain, especially if it's not resolving. Most people will be able to go back to work within a month, but if it persists, then please seek medical advice. If you do have any queries or are worried about the cause of the low back pain, please consult your medical personnel. But in most cases, there is nothing sinister about low back pain, and as you can see, it affects a large proportion of the population. I hope you enjoyed this video. Don't forget to subscribe to my channel, share, and until next time, smile because it's healthy. Bye.